When you visit a doctor with these symptoms, they will perform a thorough physical exam looking for specific clinical signs that point toward a diagnosis of heart failure. These are the objective clues that support what you are feeling. One of the first things a doctor will do is use a stethoscope to listen to your heart and lungs. In the lungs, they might hear crackling sounds, often described as rales. These sounds are caused by the popping open of small air sacs that have been filled with fluid, kind of like the sound of Velcro being pulled apart. The doctor will also listen carefully to your heart sounds. They might detect extra heart sounds, like an S3 or S4 gallop, which are low-pitched sounds that occur as blood flows into a stiff or overly filled ventricle. These abnormal sounds disrupt the normal lub-dub rhythm and can be a strong indicator of underlying heart dysfunction. The doctor may also hear a heart murmur, which is a whooshing sound caused by turbulent blood flow, possibly due to a leaky or narrowed heart valve that could be contributing to or causing the heart failure. Another key part of the exam involves checking for fluid retention or edema. The doctor will press gently on the skin of your shins, ankles, and feet. If this pressure leaves a temporary indentation, it's called pitting edema, a classic sign that fluid has accumulated in the body's tissues due to the heart's poor pumping function. They will also check your neck for jugular venous distension. This is when the jugular veins on the side of your neck appear swollen or bulging, which indicates increased pressure on the right side of the heart. Finally, the doctor will check your vital signs and overall appearance. They will measure your heart rate, which might be rapid as the heart tries to compensate for its weakness. They will check your blood pressure and assess your weight, since rapid weight gain over a few days can be a sign of significant fluid retention. They will also observe your breathing rate and effort. Combining these physical findings with the symptoms you describe helps the doctor build a strong case for or against a diagnosis of heart failure before ordering any specific tests. After the physical exam, if a doctor suspects heart failure, they will turn to a series of diagnostic tools to confirm the diagnosis, determine the underlying cause, and assess its severity. The first step is often a simple blood test. A complete blood count can check for anemia, a condition where you have too few red blood cells, which can cause symptoms similar to heart failure or make existing heart failure worse. Blood tests also check your kidney and liver function, as these organs can be affected by poor blood flow from the heart. One of the most important blood tests for heart failure is the measurement of specific biomarkers, particularly B-type natriuretic peptide, or BNP. The heart releases BNP and a related substance called NT-proBNP in response to being stretched and overworked, which is exactly what happens in heart failure. A high level of BNP in your blood is a very strong indicator of the condition. It helps doctors distinguish shortness of breath caused by heart failure from that caused by other problems, like lung disease. It's a remarkably useful chemical signal straight from the struggling heart itself. Another fundamental test is the electrocardiogram, more commonly known as an ECG or EKG. This is a quick and painless test that records the electrical activity of your heart. Small sticky pads or electrodes are placed on your chest, arms, and legs. The ECG can reveal a lot about your heart's health. It can show if you've had a previous heart attack, which is a common cause of heart failure. It can also detect abnormal heart rhythms or arrhythmias, as well as signs that the heart muscle is thickened, a condition called hypertrophy. While a normal ECG doesn't completely rule out heart failure, an abnormal reading provides crucial evidence that something is wrong with the heart structure or electrical system. It helps to piece together the puzzle. For example, if the ECG shows signs of a past heart attack in the area of the left ventricle, it provides a very plausible explanation for why that ventricle might now be weakened and failing. These initial tests, blood work, and an ECG form the foundation of the diagnostic process, guiding the next steps in the investigation. To get a direct look at the heart's structure and function, doctors rely on imaging tests. The absolute cornerstone for diagnosing heart failure is the echocardiogram, often just called an echo. This test uses ultrasound waves, the same technology used to see a baby in the womb, to create detailed moving pictures of your heart. A technician will move a small wand called a transducer across your chest. The echo shows the size of your heart's chambers, how well your heart is pumping, and whether your heart valves are opening and closing correctly. One of the most critical pieces of information from an echo is the ejection fraction. This is the percentage of blood that is pumped out of the left ventricle with each beat. A normal ejection fraction is typically between 50 and 70%. An ejection fraction below 40% indicates systolic heart failure, which is the weak pump type. If the ejection fraction is normal but you still have symptoms, the echo can show if the heart muscle is thick and stiff, pointing to diastolic heart failure or the stiff pump type. This single test provides an immense amount of information. A chest X-ray is another common and valuable imaging tool. While it doesn't show the inside of the heart in detail like an echo, it provides a silhouette of the heart and a clear view of the lungs. In heart failure, the X-ray might show that the heart is enlarged, a condition known as cardiomegaly. More importantly, it can reveal the presence of fluid in the lungs, those signs of congestion we talked about, which appear as cloudy or hazy areas. This visual evidence of pulmonary edema is a classic finding in congestive heart failure. In some cases, more advanced imaging may be needed. A cardiac magnetic resonance imaging scan uses powerful magnets and radio waves to create highly detailed, three-dimensional images of the heart. A cardiac MRI is excellent for assessing the heart muscle in great detail, helping to identify scar tissue from a past heart attack or inflammation of the heart muscle. It can provide a very precise measurement of the ejection fraction and help doctors pinpoint the exact cause of the heart muscle damage, which is crucial for determining the best course of treatment. Once heart failure is diagnosed, the goal of treatment is to manage symptoms, slow the progression of the disease, and improve your overall quality of life. The good news is that we have an excellent arsenal of medications that can make a profound difference. The treatment plan is not one-size-fits-all. It's tailored to the specific type of heart failure you have and its underlying cause. Several classes of medications form the bedrock of modern heart failure therapy, and most patients will be on a combination of them. One of the most important groups of drugs are ACE inhibitors, ARBs, and a newer class called ARNIS. These medications work by relaxing the blood vessels, which lowers blood pressure and reduces the strain on the heart. This makes it easier for your weakened heart to pump blood throughout the body. They have been shown time and time again in major clinical trials to help people with heart failure live longer and stay out of the hospital. They are truly a cornerstone of treatment for systolic heart failure. Another vital class of medication is beta blockers. This might sound counterintuitive because beta blockers actually slow the heart rate and reduce the force of the heart's contractions. However, in heart failure, the body often releases adrenaline-like hormones that overstimulate the heart, causing it to work too hard and wear itself out. Beta blockers shield the heart from these harmful hormones, allowing it to rest, recover, and actually become stronger and more efficient over time. They are proven to improve survival and are essential for long-term management. Diuretics, often called water pills, are also frequently prescribed. These medications help your kidneys remove excess salt and water from the body through urination. This reduces the fluid buildup in your lungs and legs, which in turn relieves symptoms like shortness of breath and swelling. While diuretics are excellent for symptom control, they don't address the underlying heart problem itself. Therefore, they are almost always used in combination with other foundational therapies like ACE inhibitors and beta blockers to provide a comprehensive treatment strategy. Medication is a critical part of the treatment plan, but it's only one half of the equation. Partnering with your doctor and making key lifestyle changes is just as important for managing heart failure successfully. One of the most impactful changes you can make is to carefully monitor and limit your sodium intake. Salt makes your body retain water, which can worsen fluid overload and put more strain on your heart. Your doctor or a dietitian can help you learn how to read food labels and choose low sodium options to keep your daily intake in check. Regular, moderate physical activity is also incredibly beneficial. It might seem strange to exercise a weak heart, but it's one of the best things you can do. Activities like walking, swimming, or cycling can strengthen your heart and other muscles, improve circulation, and boost your energy levels. It's essential to start slowly and follow your doctor's guidance. Many patients benefit from a cardiac rehabilitation program, which provides a safe, supervised environment to learn how to exercise correctly and build confidence in your physical abilities. Monitoring your symptoms at home is another vital skill. This includes weighing yourself every morning after you've used the restroom but before you eat. A sudden weight gain of 2 to 3 pounds in a day, or 5 pounds in a week, can be an early warning sign that you are retaining fluid and you should call your doctor's office. Keeping track of your blood pressure, heart rate, and any changes in symptoms like swelling or shortness of breath allows you and your healthcare team to catch problems early and adjust your treatment before they become serious. In closing, a diagnosis of heart failure can feel overwhelming, but it is far from a hopeless situation. With today's advanced diagnostic tools and effective treatments, people with heart failure can lead long, productive, and fulfilling lives. The key is early recognition of the symptoms and a commitment to working closely with your healthcare team. By understanding your condition, taking your medications as prescribed, and embracing a heart-healthy lifestyle, you become an active partner in your own care. You can take control of your health and look forward to a brighter